My name is Kenny Lamb. I'm 60 years old. I've got my own painting and decorating company here in Edinburgh, and I'm very much a hands-on kind of person, and I need to be fit in order to do my work properly. We have a history of osteoarthritis in our family and rheumatoid arthritis. My knee has been deteriorating quite badly over the last year, 6 months, to the point now that my knee is always inflamed. It's very, very stiff at the back of the knee, and also the pain is there 24 hours a day, 7 days a week. Last year when I met Mr. Patton, he recommended or suggested that I could possibly be a good candidate for this new procedure that was going to be coming available. My understanding of this procedure is the damage to any surrounding healthy bone and tissue is going to be greatly reduced than the procedure that was offered before. And I also like to take part in sports, and that's an important part of our lifestyle that my wife and I have. So we go to the gym 3 or 4 times a week, we walk, we swim, we do a lot of spin classes. So it's important for me, in my life, that I get something that is going to be a permanent fix, not something that's going to leave me with an 8-inch scar, that my motion, my movement in my leg is going to be restricted. There's no room for error in this. 2 weeks ago I went into the hospital and I got a CAT scan done. This was sent away and a 3D image of my knee has been made up, which gets fed into the Mako machine. This procedure is customised for my knee. I think back in the old days, everybody got the same thing, no matter what your build or your age, we all got the same procedure. But nowadays, with this new type of technology, everybody is getting customised partial knee replacements. I'm very excited about it, purely for the fact as well that I'm going to be one of the first people to receive this procedure. So I'm excited about that. Maybe slightly nervous as it's drawn near to the time, but I'm looking forward to not having any pain in my leg and being able to walk without a limp. Well, we're here in the Spire Murrayfield in Edinburgh today, and I'm having a partial knee replacement carried out by Mr. Patton. I just spoke to him not so long ago, so everything's sort of good to go. He just went through the usual questions, or tell me what the procedure is going to be. The thing I'm looking forward to most is to walk in normally again. At the moment I have a limp which has progressively got worse as time has moved on with this in the last year. So not to have a limp, then the pain which is there constantly, and it gets worse at night time, so not having any pain is all I'm looking forward to. And just really go back to my normal activities like I did before. So yeah, quite happy to be here at long last. Here we are, 16 days after my operation. I had the robotic arm assisted surgery carried out, and I'm glad to say, in fact I wouldn't believe how good I'm feeling today, 16 days on from the operation. I went into the hospital around about 1:30, 2 o'clock on the Tuesday afternoon, the 4th of July, and my operation was taking place early evening, around about 6:30, 7 o'clock. I came back down to the room about 10 o'clock once I wakened up from the anaesthetic in the recovery room. My hospital stay was only for 2 nights, and I couldn't believe this. I thought this is going to be longer. I always remember my mother was in hospital after having a new operation done, and she was in there, it seemed like a lifetime. But here I was only in for 2 days. I was actually in a day and a half. I was discharged on the Thursday lunchtime, and that was me coming back home after having this major operation on my right knee. My time at the hospital with the staff, etc., was very, very good. All the staff were really kind and attentive, making sure that I had enough painkillers and I was comfortable at all times. Physiotherapists were coming in and they were getting me out of bed right away the following day, 10 o'clock in the morning, so I was only maybe 12 hours after the operation and up about in my room. Started off with a Zimmer. I got to the door of the room using the Zimmer, and then the physiotherapist saw how well I was doing. She gave me the walking sticks. So I was up and down the corridor a few times in the walking sticks. So again, I was quite surprised how quickly I was up on my feet and I was moving around. I'm very excited actually about how things have turned out and how well things have turned out, because you still have that wee slight sort of 5% or 10% saying, is this going to be okay? Am I going to walk again? Because as I say, after the operation, you realise actually what was carried out. But I'm getting back to normal, and I don't have any arthritic pain whatsoever in the knee. I still have some post-op pain, but the physio has assured me within the next few weeks that will recede and I'll just get back to just being normal again, if that's the right expression. I did say to him, what did people say about having a piece of titanium in your knee? And he just says, nobody's mentioned anything about it. And I thought that was strange. I thought you'd feel this, but there's nothing at all. So it's just, I'm walking around my house just now, and it's just, I'm walking freely. I don't have a limp. I had a limp for about 2 years, 2.5 years. I don't have this now. And it's amazing. You just feel that, you know, people are not looking at me because I'm not an old guy, I'm a young guy. And I'm walking with a limp. But now here I am, walking around quite confidently. Every day my leg is getting stronger, my knee's getting stronger. Also as well, when I was at the physiotherapist the other day, she was encouraging me to walk down the stairs because it's quite hard to walk down the stairs because your knee's bending. I've now, in the last couple of days since I've been back from physio, I'm now walking down the stairs unaided. So it's really, really good. I'm very, very pleased. The fact that I don't have any pain is really the thing that pleases me most of all. And I don't have a limp. I think I mentioned previously that every time I was walking, I had this limp and it seemed to be getting worse. And you're thinking, my God, I feel so old. But you're just restricted so much with the movement that you had in my right knee or leg. So here I am now, as I say, 16 days after operation. Not exactly doing my Michael Jackson moonwalk yet, but that'll be coming, I'm sure, in the next few weeks.